Hi, Dr. Henry. With regards to the outbreak here in Kelowna at the Kelowna school, could you elaborate these 5 cases? Are these students or staff?
It's a mixture of students and staff, so it is both, and it's in cohorts that were mixing together, but also there's been, like everything, some of it is on looking at exposures that may have been on school buses and other settings as well. If we look overall, and I am being quite cautious because we know that if we give specific numbers when there's such small numbers like this in a small community, people can be identified. But if we look overall for the 216 events, exposure events we've had, they reflect about a third of them are in staff and about a third are in students. Or sorry, 2/3 are in students, and that reflects the numbers of children versus staff as well.
Do you have a follow-up, Nick?
Yes, thank you. With this Kelowna outbreak, are you able to provide a timeline of when the first case was identified at the school and when it was discovered that transmission had actually occurred within the school?
I actually don't have the details of when the first exposure was. I know Interior Health has been providing more details around that, but it certainly came to light within on the weekend, last weekend, and then the investigation started on Sunday this week.
At what point do you think the government would or should step in to close a school like this until further notice?
Yeah, so the medical health officers, the school health officer in Kelowna is leading on this with the school, with the principal, making sure that we know and are doing the detailed investigation that we do for all of these outbreaks. And right now, they're confident that they've addressed people who have been exposed. But that is, it is a possibility if the investigation shows that there have been other exposures that come to light in the course of the investigation, then that might be an option. It may be another cohort may need to also be monitored or isolate, or it may need to close the school. I think that's unlikely given what I understand about this outbreak and the investigation so far. One of the things that we talked about early on when I was asked, what would close the school would be if there was large numbers of the staff who needed to be in isolation because they had been exposed and there wasn't able to operate the school safely. That's not the case right now in Kelowna, but obviously these things evolve over the days as the investigation goes.
Phil, do you have a follow-up?
I do, thank you very much. Going forward, do you think the outbreak at this school will bring with it changes to guidelines or protocols within other schools in BC?
Well, we learn from every exposure event, we learn from every cluster, and we learn from every outbreak. And we've seen this from our long-term care, how we approach outbreaks in long-term care. We learned a lot very early on. So this is our first school outbreak, and we will learn from it. And if there are things that come to light that will help reduce potential for this happening in other schools, then absolutely we will be looking at how we can expand those measures to every school.
Your opening comments about the outbreak in Kelowna at the school, I think I heard you say that they were unlinked transmissions. So does that mean these are people that got COVID from outside the schools and brought them in, or that it has spread within the school?
Yeah, so it is spread within the school. The index case, somebody brought it in after being exposed outside of the school environment. And when we do the detailed asking of each person and trying to figure out who had contact with who, we recognized there were some people who were ill, and when they were tested, they were positive. And so now's the time that they're trying to piece together how they might have become infected in the school environment. So yes, it means that there was transmission happening in the school environment that we're not quite sure how yet. And that's where the outbreak investigation is really important and helps us piece that together. So it's like putting together the pieces of the puzzle. But as soon as we recognize that there were cases that we're not quite sure how they got them, that's when the outbreak was declared, and people were sent home for self-isolation, and so the investigation could be done while making sure there was no further transmission happening.
Rob, do you have a follow-up?
But it came from one person that spread it to the other 4 so far. And do we know this is a French school? Would this have come from, say, someone coming up from Quebec?
There's no link to Quebec that I'm aware of, but there certainly is links to travelers from other parts of the province who may have been the source of the original case. And this is what we're still trying to piece together, who passed it to whom when. And that's part of the challenge of this. And that will become clearer as the outbreak investigation continues.